Hello, everyone, and welcome to the Work in Progress podcast with Adnan Ghor. Today, we have a special guest with us. He's lived through many of the questions which we may have, but he wants to inspire many of us in his dental career and go through the challenges he's faced. But also, we want to understand a little bit more about the purpose and connection that he's had with people around him. Welcome, Dr. Mohammed Dungarwalla.
Thank you. So lovely to be here with you, Adnan. I'm truly honoured actually to be your first guest here, so thanks. This has been a work in progress for you for a while. I know you mentioned this to me a while ago as well. So firstly, it's good that this has come to fruition. And to be honest with you, I don't know what's going to come of this. Maybe I might learn a little bit about myself, but hopefully as with these things, want to kind of speak to other people as well, maybe. And as you say, answer some questions that other people may have about my journey to how I've got to where I am.
Agreed. And I think, like you said, this is a podcast that's still in work in progress. We don't know where it's going to go, but hopefully it helps our listeners and inspires even one person today. Now, I know a lot of people refer to you as Fly MD.
Yeah.
Or Fly. Has no connection with Dr. Mohammed Dungarwalla.
No.
Tell me where it came from.
So actually, if this actually first started, and a lot of people don't know this, my name was actually MD Fly, but not many people know this. And this was from probably about age 12 or 13. Fly MD is a play on the slogan Fly Emirates. And I'm not here as a plug for Emirates. I do fly with Emirates quite often, but I'm not here as a plug for Emirates. So Fly MD was based on that. It's a play on Fly Emirates. MD is obviously those are my initials, and it was my obsession with aeroplanes. And then I got the nickname Fly MD, and then it just stuck. I think there are some people that don't actually know my name and they just know me as Fly. And a lot of people, this is another thing, a lot of people think Fly is, because you're so fly. As I know, it was never because of that. It's because of my love for aeroplanes. So that's where Fly MD has come from. And it's just kind of stuck. And now I'm in my 30s, I'm thinking, should I get rid of the name? But it's just, I think it's always just stayed there. So there's no plan to get rid of the nickname.
It's funny you say that, actually. When I speak to some people and they say, do you know Dr. Mohammed? They say, no, I'm not sure who he is. I said, do you know Fly? I said, yeah, I know who that is. And straight away that connection is there. But people know that you love planes, and they sort of know who you are. I see some people also know you as Dr. Mo.
Yeah.
But I think Fly is probably more.
Yeah. So I mean, some people call me Dr. Mo, Dr. Mohammed, but
is that more professional?
It's more professional, but also on the professional, from that point of view, I actually just like to be called Mohammed, although I try not to use the doctor title. I've got my own reasons for that, but I think it's important as people, we just refer to each other as how we like to be called. I understand there are some domains where it's appropriate to use titles. So I've got no issue with using titles for other people, if the situation demands it. But on an everyday basis, I'm very happy for someone to just call me Mohammed, because I was Mohammed for most of my life, so I prefer to be called just that.
Very interesting.
Or Fly.
Yes. Going back to the point you said about doctor.
Yeah.
Do you think that has enabled you to form better relationships with people, or is it sort of something that's created a barrier when you do use it, or are there certain situations where you feel that you do use it for?
I really try when it comes to a personal meeting or whatever. I don't use the title at all. I might tell someone my profession if it comes up, but again, in a weird way, I don't want that to be my identity. So I try not to use the title, even though it is the title used in many of the arenas I'm in. So yeah, I would avoid it. I don't think it's been a barrier, but I don't want it to be the driving reason of why I've created a relationship or a connection
That makes
with
sense.
someone.
You want people to know you for Mohammed Dungarwalla
Yeah,
and who you are as a person.
exactly.
Very interesting. And people also knew you as Fly MD,
Yeah.
or still do know you as that.
Mhm.
The relationship between that,
Yeah.
I can see you know what the questions, what questions coming here. What's the connection between that and dentistry, and where did sort of dentistry stem from?
So I don't think there was that. I can't say there's a massive connection between um, Fly MD and dentistry. There was this kind of childhood, teenage dream that I would become a pilot, and I still cherish the kind of memories as a child and teenager of, like, going in the flight deck, being in the flight deck whilst a plane was landing, sitting with the pilots, and then still thinking that I was going to become a pilot. The whole dentistry thing comes from, it was really more of a case of, and I think a lot of UK A-level students, I'm sure it's not just the UK, I think it's worldwide, but in the UK in general, you're kind of at this stage in your GCSEs where you have to start thinking about what do you want to do as your career. And to be honest with you, I didn't really know what I wanted to do as part of my career. And at that point, the flying thing was more of just a background passion. It wasn't like something, do I see myself flying to different destinations? Because I'm sure pilots will tell you, and I've seen this on pilot Instagram accounts and stuff like that, that the job is not as glamorous as it's made out to be. There are significant sacrifices, as there are with my job as well, but there are significant sacrifices. So the pilot thing wasn't serious in terms of an actual profession. And then when we were at school, I knew I liked the whole science, I liked the biology side of things. But then, as you can very much appreciate, we are from business-minded families, right? So parents have been in business, grandparents have been in business. So that was always kind of in the back of my mind. Am I going to do something business related? And then I saw one of my friends who he applied for dentistry, and I think for him the answer was a lot more obvious for him to become a dentist. But then you realize actually with dentistry even, you can run a business, you can engage in the science if you want to, and the two kind of marry up. At least that's what it is on paper. It turned out my career took a completely different path, but that was the reason I went into dentistry. But I never saw myself as a youngster going into dentistry. I never really thought of it as a career prospect. But kind of did it, and then just didn't look back.
And as you were going through your journey to becoming, correct me if I'm wrong here, but oral maxillofacial?
So I'm an oral surgeon.
Okay.
So oral surgery is it's a branch of dentistry. And to kind of get to this point, I did spend some years doing oral and maxillofacial surgery. And there is a lot of overlap. So maxillofacial surgery is basically surgery of the face, mouth, the jaws, the neck. And in this country requires a dual qualification in medicine and dentistry. A lot of the conditions that I see and treat, in fact, all of the conditions that I see and treat can be treated by a maxillofacial surgeon, but maxillofacial surgeons have done further training, and they treat the kind of the head and neck cancers, the facial trauma, and they've done extensive training, because obviously they're doctors as well, to do, the really invasive surgery. But I work alongside them. I'm part of the same team as them.
Okay.
So that there is a difference between the two, but a lot of the conditions we treat are similar.
Okay. And so when you took your journey for dentistry, did you know that was your goal, or did you sort of have smaller goals along the way? And I'd be interested sort of just to hear a little bit more about the people that you met along the way, because I can imagine education obviously is a part of it,
Yeah.
but you probably had things like work experience or in those in the early days, but as you kind of progress, sorry, I'm not for the medical or sort of dental field,
Yeah.
but I know that you have to write papers and do a lot of research and not know the right people, but have connections with the right people,
Yeah.
relationships, is a better word,
Hmm.
to be able to understand what does that involve and what path do you want to carve for yourself.
I don't think a lot of people know that they want to become an oral surgeon unless they've got someone that they know that's already doing it, a family member or that kind of thing that's already in that kind of field. But when I applied for dentistry, I just thought you go to the dentist, fillings, root canals, dentures, crowns, that kind of stuff. That's what I thought a dentist did, which is what a dentist does. But that was what my work experience was. And so I went to watch a dentist, my own dentist, and he was very welcoming. And so when I sat there and I was watching the procedures, I wasn't put off by it. I thought, yeah, this is something I can do. Was I like jumping for joy when I saw it? I don't know. And actually, things changed when I did a different type of work experience. And actually, this is a dedication to my sister, because my sister actually got me into this work experience with a maxillofacial surgeon. So thank you to my sister, if you are listening, because I know you think you are the start of my career or where I am now. So
Proud sister there.
yeah. So she had her wisdom teeth taken out by a very prominent maxillofacial surgeon who I had no idea who this guy was. And then I went with her to one of her follow-up appointments after she had her wisdom teeth out. And then, kind of asked him the question, oh, can I come and watch you do some work experience? And he was like, yeah, sure, we'll arrange it. And actually, this might be something that you come onto. A lot of people now are struggling to get the right work experience with people. And this man did not hesitate to offer me work experience. So then I ended up in the hospital. I was 18 years old. I'd just finished school. And next thing you know, I'm in theatre. This junior dentist came up to me. He's like, what's your favourite chocolate bar? He brought me a chocolate bar. He's like, this is so you don't faint. And then I was just thrown into theatre, and I was just watching this surgery of this guy's neck, like completely open. And these maxillofacial surgeons were doing surgery on this guy's neck. And I was just there. I was completely like, it was jaw-dropping stuff. And I was like, this is so cool. I loved it. And then I was like, this is a different side of it. What's really important though, I remember watching this surgery and these guys were listening to Beyonce. There was Beyonce playing in the background, and one of the surgeons goes to the others like, oh, is this Beyonce playing on the radio? And it just reminds me that these are normal people as well. They've done like 20 years or more of training, but they are still listening to Beyonce like the rest of us on the radio. So then I went into dental school, and dental school was good, but there were some things I was just not good at, and some of my dental colleagues will know as well. There were just some aspects of dentistry I was not good at. I didn't have an eye for the artistic, really beautiful work that some people can do to make, these natural smiles and stuff like that. I always went towards the medicine. I went towards the surgery. Those were the bits. I learning about different diseases that affect people. I was always into that kind of stuff. And so I kind of knew in the background, like those things were easy for me to learn. So like my advice to anyone is, if you're finding something that's really easy to learn, it's probably something you're good at and something that you should probably look into as a career prospect. And I found the surgery stuff easy to learn, and I enjoyed being on those clinics. So if I then qualified, I did a year as a general dentist, like a lot of dentists do in the UK, but then I went straight into hospital and I went into surgery. And then you asked me about people who I'd met along the way. And then you meet people on different stages of the hamster wheel, basically, all trying to make it into wherever they've decided their career is going to go. And I met a few people who took me under their wing, but also they see the potential in you. There's very few of them. There are some, I'm just going to be brutally honest here. There's a lot of people there that they're just kind of there doing the job. Some people are in it for themselves. Fair enough. There are a few people there that actually want to see you do well. And I met a few of them. And then because of that, I got the opportunities. But with that, I had to work hard as well. So I had to do the papers. I had to do the projects. I had to stay behind until like 8, 9 p.m. doing the stuff, and then even later, and then the weekends as well. So then everything else takes a bit of a back seat whilst you're doing all of that, going towards your career. So that, and then I went to do my oral surgery training. So this is where I am now. I finished my oral surgery training. I'm now an oral surgeon. I mean, there's lots and lots I could talk about to go there. But that's in a nutshell how I got to where I am now.
Thank you. And I wanted to speak a little bit more about the connections you made along the way.
Yeah.
I found that very interesting because in this sort of situation, you said sort of that you were able to make those connections, but that doesn't just come about. You have to speak to certain people or speak to relatives or friends or people that you met along the way. And some people you meet and then you sort of don't speak to for a long time. But how did you get to getting to those connections to allow you to have an opportunity to showcase? Because I guess what I'm getting to is showcasing your passion for something is one part of it. And I agree that sort of comes out authentically.
Yeah.
But getting to that point, and many people are extroverted, many people are introverted.
Yeah.
Or there's other, obviously, and there's a lot more personality types now. But giving someone the confidence to be able to take the courage to actually take their first step to go and ask, I want to be able to do work experience, or how did you do this, or how did you get to this place in your career?
So I would say, and I'm still doing this now, is putting yourself out of your comfort zone, because I consider myself to be introverted. People have told me I'm not introverted, but if there was an opportunity for me to just sit there quietly, I would take it. I really don't often like the interaction. I like being with my own thoughts. But that doesn't get you far, especially if you're aiming towards a particular career, or you want to get something which is quite competitive. You need to put yourself out there. People need to be aware of you. I was actually having this conversation yesterday evening with a junior dentist. And one thing I said to her was that if you are not visible to the other surgeons, to the senior surgeons, they're not going to know who you are. And as the saying goes, out of sight, out of mind. So if you are not physically visible, if you do not approach these people and just say, I'm really interested, are there any opportunities? Don't get me wrong, not everyone's going to, firstly, people are not going to reply to you. Some people won't engage with you, but you just need 1 or 2 people to just give you that opportunity. And it won't open a door, it will put your foot in the door. And I don't like saying this, but sometimes it's just right place, right time. Sometimes I was there and I was thinking, how is this going to work out for me? I don't know how I'm going to get to the next step. But you always find a way. Sometimes it might take a bit longer than you expected, but you will always find a way. And I'm still trying to do that now with my career. I'm still looking to go to the next step. And I'm just looking for the avenues to do that. So you need to keep speaking to people. You need to keep asking people, and persistence. You need to kind of be a little bit annoying, but not too annoying. I don't know where the balance is on that one. But one thing I would say is never, ever sit in silence, because time just goes. Time just flies by and you'll just continue sitting there. It's the ones that make the noise that will get somewhere.
I guess the worst that someone's going to say is no, or they won't reply to you.
Exactly.
You haven't hurt anyone's feelings, and nothing has come negative from it.
You're in the same position you were in.
Yeah. And
You were before.
in some way, I would say you're in a better position because you at least took the courage to take the step to actually ask somebody if you could actually have the experience or any questions that you wanted to ask them.
Exactly.
Do you have people coming to ask you a lot of the time, or do you find people are a bit more reserved? I know I'm being very general here.
No, so I actually, it's probably one thing that I'm trying to manage with my own personality at the moment is that I get people asking me for advice. I would say on a daily basis on my Instagram account. In fact, the other day on Sunday, I was on the phone with someone. I've never met them before, but they follow me on Instagram, and they've always, they've been appreciative of my work. And then they approached me and they said, "Look, I need some advice. I'm in a bit of a difficult place at the moment." And so I spoke to them on the phone on Sunday just to give them my advice. I don't have all the answers, but I can always give my take on certain things. So I get that pretty much on a weekly basis. There are people coming to me asking for advice. And that's a nice thing. That's a nice thing to be approachable. It can be quite exhausting sometimes as well, that you're constantly being asked stuff. But I would always have it this way rather than the other way, where people are coming to ask me because they value my advice, or, they value the fact that they can come and speak to me and that I'm able to give something useful for them to act on.
But I agree. I think that warm trait to have is a very difficult one to come by, and it's sometimes we might come across as cold to people, or sometimes warmer to other people. Everyone's obviously got their own personality, but it's nice to have that because you felt that you've been supported along your career for the people who've got you to where you are.
Yeah.
And you want to be able to do the same.
Yeah.
And that just goes to show that you're one person who someone may message you and you may not respond because you're busy or what have you.
Yeah.
But right time, right place, they might message you and they may be able to find something inspiring for them or find them on their own path to where they want to go.
Yeah. And I think, and for the whole reason why you're doing this podcast, right? You're trying to inspire at least one person. So if someone does message me on a Sunday or something like that, because I get the messages on Sundays and stuff like that, and if I'm able to give something positive, I don't see why that's a bad thing. Because at the end of the day, if I'm busy, then I'll just reply when I have some time. I find that it's important to actually try and help people as and when I can.
And when it comes to social media, I want to. I know you've got the Instagram account, the Wisdom Tooth Guy.
Yeah.
Everyone follow Dr. Mohammed on that.
Yeah.
Oh, sorry, Mohammed. But
Fly. Yeah.
Fly. When it comes to your Instagram account, that in itself builds relationships with people.
Yes, it does.
And I know in different careers or different industries as well, personal branding is becoming quite a hot topic.
Mm-hmm.
Everyone's got their own opinion and view on it.
Yeah.
From a dental point of view, or maybe from an oral surgeon point of view, do you think A, is it necessary? And B, do you think it's supported you in building the right connections? I know many people aren't really so they're not as tech savvy with social media.
Yeah.
And that's from different generations. Older generations obviously are less tech savvy than younger, but I know a lot of people in the younger generations that they're not keen on social media. They'd rather stay away from a screen and have those honest relationships, which is great. Yeah. But does that hinder you from anything in your career?
So I think, look, the social media thing, and this kind of links to me being an introvert, because I did not like the idea of being on social media at all. Like, in fact, even now thinking about it, I don't like the idea of being on social media. And then I have a good friend and who I speak to regularly, and he was already quite big on social media. And he said to me, I think you just need to get out there and just put your name out there so people know who you are. With the kind of work I do, it's slightly unique in the sense that if, for example, you wanted to go and see someone to improve your smile, there are a load of dental Instagram accounts out there, and you can be like, oh, I like this style of work. I'm going to book in and see this person. But no one really kind of looks for an oral surgeon to take out their wisdom tooth or something like that. So the whole strategy of my Instagram account is made for other dentists. And it's actually, I think it's helped a lot of the people I teach. So if you've seen some of the content on there, it's been educational. And that's targeted a lot of the people who are very early on in their careers. And I think it's benefited them. There's also that element of you are constantly in the spotlight. And there will be people out there scrutinizing other dentists and patients as well, because anyone can follow my Instagram account, right? And so I have some patients on there as well. So I have to be mindful that anything that goes on there is in the public eye. And you might perceive it in one way, but you've got to remember how someone else might perceive that. So does the social media help? I still don't know, is the answer. I think the jury is out. And I don't think you need an Instagram account or a TikTok account or something like that. I know people doing my type of work, and they're not on social media, and they're doing well. You know, that they are operating well. They don't need that kind of influence, because remember, a lot of the work that comes to me comes from other dentists. I very rarely get patients approaching me directly for work. It's a handful of times a year, but then majority of stuff is coming from another dentist. So my Instagram account is important for other dentists, not for other public, for the patients, really.
It's interesting you say that, because so from my perspective, I know you've sort of done this even before you had your Instagram account, but you'd showcase the imagery, or it's very graphic imagery sometimes, of what you do, and it's very graphic. But I personally found it quite amazing that happens within surgery. I guess unless you're having surgery or you're in that field, you don't see any of that. And it's quite gruesome at times.
Yeah.
But it's the reality of it.
It is. I think a lot of the people, especially like my family, because sometimes I'll just go home and I'll show my family, I'm like, look what I did today. And, you know, they're just like, why did you show me that? And sometimes as a joke, I'll go to my family, I was like, do you want to see what I did today? And then they're just like, no, I don't want to see what you did today. But as you say, it's the reality of what I do. And what I say to people is like, that's pretty much all inside us. Yeah, this is us, just a few layers beneath. So what you're seeing is what is inside all of us. I'm just kind of digging a little bit deeper. And I understand it's not everyone's cup of tea. I totally get that. But for me, seeing that kind of stuff and doing that kind of stuff, that is the fun part of the job.
But it also takes courage to be able to do that, because you could teach in the way you're teaching at the moment, which is great. But there is an audience out there that probably learn better on social media. And they might just be sitting there in their room flicking through Instagram, but they might come across your page and be inspired. So you've built that relationship with a student who you're probably taking them on their journey, and you don't even know where that's come from.
Someone said to me actually the other day, they said, oh, I learned this technique because I saw you doing it on Instagram. And I had no idea. I had no idea that they had even looked at that post. I had no idea that they had done it until they told me. So I think I'm having an impact. You just don't know sometimes who the impact is going to reach. So
Very true. Very true. That's very interesting. So I want to double down a little bit more on yourself within the theatre,
Yeah.
or when you're sort of operating in surgery.
Yeah.
Are you one of the most senior in the room, or would you say sort of you're in the middle, or what's your position?
When you start off in theatre, you'll probably be one of the most junior people in there, and you're assisting, and there'll be more senior surgeons. But as time has gone on, you become the most senior person in the theatre. And as someone who I work with put it, it's your name on the door. So any decision that's made in that room will be under your name, the good, the bad decisions. So yeah, right now, the list that I do, I'm the most senior person in the room, along with the anaesthetist, who is equally as senior. I don't like to use the term senior as much because I can't do my job without all of the other people in there. But if you had to ask about who does the final decision rest with, it's me and the anaesthetist. And
in that environment, next to the anaesthetist,
yeah,
and other people within there,
that's the person who puts someone to sleep. Sorry, I had to just qualify that because I appreciate not everyone may know that. So yeah, that's the person who puts people to sleep. Yeah,
very true. I can see that being quite a high stress environment. The lights, sort of, I guess, the material you have with the patient, the situation, and with that, there's probably a lot of unfamiliar people in their room as well. People you may have not worked with potentially before.
Yeah,
and those relationships you need within that, you need to build that level of trust, and that's within an instant.
Mm-hmm.
That level of trust and confidence that you can confide in person A who's helping you do procedure X, whatever it may be. How do you sort of come about pulling yourself together within that situation? And I know there's a recent paper that you wrote. I know you wrote a paper about dental safety. Is that correct?
Yeah. So most recent publication was on patient safety and looking at patient safety and how it's evolved 10 years on.
And there was a part in there where you talked about an airline, I think it was a Korean airline, and how the interaction or the relationship between the first pilot and the co-pilot. I found that quite interesting actually because it links back to aviation.
Yeah. That's why I talk about these things. I try and link it back where I can.
But it's great because you've still got a passion for aviation. You didn't go that way, but you link it back into dentistry, oral surgery. In that environment, I guess my question is, one phase is how do you build those relationships?
Yeah.
But second to that, there are people, like I said, there's the senior surgeon whose name's on the door. That's the person who's responsible.
Yeah.
Now, if I'm a junior in there, I'm not going to speak up, or I may be a bit more nervous to speak up to them.
Yeah, absolutely.
But it's not to say that the junior is always wrong. Some industries call it upward management.
Yeah.
How does that work? Do you think that's a good idea? And how do dentists operate in those situations?
So I would say firstly, I'm quite honoured that you read the paper, which is it's quite nice to see. So that whole Korean Air cargo flight was basically about a very senior captain and then the first officer. The first officer was scared to question the seniority of the captain, even though the first officer actually had the right idea of what was going on, but was scared to say anything. And I think this is something where medicine in general, so not even dentistry, we're talking about medicine learns a lot from aviation. Aviation is far ahead of medicine when it comes to safety and stuff like that. And I think the main thing is now empowerment. And one thing is, when you're working with a group of people that you've never worked with before, it's important for them to know that, you are the surgeon in charge. You are the person that will be doing the procedure and ensuring the overall well-being of the person in front of you. But there are always opportunities for people to speak up. for me, when I'm now going into these high pressured environments, before I do a surgery, I've probably thought about that surgery about 100 times in my head, how I'm going to do it, where I'm going to make the cuts, where I'm going to use, this piece of equipment, how I'm anticipating something to come, or how I'm anticipating something to work out. I'm anticipating the complications as well that can happen, how I'm going to manage it. Do I have the equipment on standby? Do I have the right team members around? So sometimes if I'm doing a particularly challenging case, sometimes I'll make sure there's someone who I trust in the building. They don't need to be there near me, but in the building available, just in case things go pear-shaped, or if they just go a little bit unexpectedly. And that combined with making sure that everyone in that room is empowered. So I always ask at the beginning of every single list, does anyone have anything that they would like to talk about or mention before we start this list? I think that's really important, that everyone has a voice in these things, because as we've learned, mistakes happen when people don't speak up. So yeah, that's kind of how I'm working at the moment. It may change as things go forward, but that's the kind of the routine at the moment.
You said before that you're introverted.
Yeah.
Yet in a situation like that,
Yeah.
you have to be able to hold the room.
Yeah.
And you have the courage to ask that question.
Yeah.
Because many people who are potentially introverted, and correct me if I'm wrong here, but they could just start a procedure and not sort of ask those questions because they feel too ashamed, or feel that because they should have no authority, but they should have the knowledge or the experience to be able to just do it.
Yeah.
But you're actually becoming a bit more vulnerable in some way, and you're asking, does anyone have anything they want to say to be able to support me and us in this team to undertake this procedure?
Yeah, you're right. You have to be able to speak up. You have to show vulnerability, and I think one of the main things that I'm learning now, I'm still learning, and this is with team members and patients as well. It's okay to say that, look, I'm not the right person to do this. I know who can help you, but I'm not the person that can do this. Someone else has to help me on this one. So I think the pride element here as well needs to be lost, because I think pride can really, really consume people in the room. And it's fine to hold your hands up and just say, look, I'm out of my depth here. And I have done that. I ideally want to get to that stage before the person's in front of me and I've got to do a procedure on them. I try not to let it get to that stage, but I will say, I will hold my hands up and say, I'm not the right person for this.
In the world we live in today,
yeah,
that's, I guess, ever more digital, moving with AI and things.
Yeah.
You think we're on social media, and we all know that there's an element of a different person on social media.
Totally.
But to not have the screen in front of you in a situation like that, and I mean sort of that metaphorical screen in front of you, and just to be vulnerable, to build those relationships around you, it's pretty hard. And I feel like it's getting harder as we have a screen to hide behind in general situations.
I think, what you see a lot on social media is not always a true reflection of that person, because as you say, we've got that screen to hide behind. So I think it's important that we don't portray ourselves in the same way when we're actually working with people. We need to actually be honest and upfront about how we are, because at the end of the day, there are people that will be experiencing the consequences of your actions.
And through this sort of conversation we've had so far,
I
can see that you haven't had it all figured out. You never had it figured out from when you sort of were speaking to your friend and wondering what they wanted to do in their career.
Yeah.
And I assume even today, you haven't got it all figured out. But when we look inside yourself and sort of, I guess, look inside you, or you look inside yourself as a person, do you think there's certain things that you haven't got figured out and you want to still progress on?
Yeah, so it's funny because a lot of people ask me like, "Oh, how did you know what you wanted to do?" And I kind of say it in jest to them as I still don't know what I want to do. I didn't know I wanted to become a dentist. I know from the surgery side of things, I really enjoy that. But there have been days where I've said to my nearest and dearest, I've said, this is really stressful. I did not think it would be this stressful. And have I made the right decision on this one? And it's really sad because I teach a lot of dental students, and I've had the privilege of meeting a lot of dental students, and a few, not a lot, but a few have said that I'm not sure if I want to do this career. Because they're figuring it out as well. And what I do say to people is that if they're still trying to figure it out, it's not the end of the world. You can still do something else. Like, I'm still toying with the idea of doing something slightly different. Whether I use my current career, because there are skills you've picked up in this, just, managing situations, communicating with people, you can go off and do something else. So I don't think it's a bad thing if someone's not sure what they want to do. I know that I enjoy most of what I do at the moment, and there are some really positive sides to it. Like, I do think that I make a difference to people, and I'm not just talking about the patients I treat, I'm talking about the people that I teach as well. I think I do have a positive influence, and that's a really nice thing. But also, I don't know if I want to be doing this forever, or do I want to be doing it in a slightly different format. And then you asked me about what am I still trying to figure out. I think so. Whilst all of this has been running in the background, I'm sure you individually, and you won't mind me saying this, will probably appreciate it's very hard to not be a people pleaser. And I'm still trying to figure out how not to be a people pleaser. And there might be people listening to this laughing because they're going to be like, yeah, he's a total people pleaser.
I'm the same.
Don't worry. I know you are. That's why I've said it. But it's actually that trait, no one wins from it. I've realized, because you're not happy and the other person is just basically expecting it almost. So this is one thing if you ask me, what am I trying to figure out? I'm trying to figure out that. One thing that I've become slightly better at is saying no to people. This kind of links in with the whole people-pleasing thing. Still figuring that out, but also saying no to people. And I think that's also really important. This links in with the whole career thing, because if you want to go down a particular career and it's really challenging to get to a certain point, you will say yes to everything. Someone will say jump, your response will be how high. But then there has to be a point saying no. This is where I draw the line. And I think the generation coming through are actually much better at that. They know what they want and they know how to achieve it. I don't think that kind of permeated through to our generation. I think we're very much a reflection of our parents. They just constantly grafting, working, and did what was necessary, and that's kind of what we looked at, and that's what we've just learned. And we've kind of we're slowly starting to change, we're starting to adapt, but I don't think it's fully permeated through yet. So those are the bits I'm trying to figure out still, and when I get somewhere I'll let you know. You might notice a change when you ask me to do the next podcast and I'm like, no. So I don't know.
It's funny, I've known you for many years.
Yeah.
And have always seen our personalities be quite different.
Yeah.
But the one thing we're trying to figure out is pretty much the same.
Yeah. Yeah.
It's actually, I wasn't expecting to come to this topic or this sort of part of the conversation, or understand this, but I've quite inspired by that, as in someone else with a different personality, different complete industry, career background.
Yeah.
Is having the same challenge as I am, of one of the same challenges, obviously we're still figuring out in terms of people pleasing. And it's not an easy one to figure out. And sometimes we're never going to stop that.
Yeah, there'll be an element of it. And then, so, I always kind of look back. You look back and you're like, why am I like this? And then you don't have to look far. Like I just look at my parents, and then you're like, okay, this is where it's come from. We are a product of our environment. And then there's so many other things that kind of link into it. You've got people talk about superiority complex, inferiority complex, all of these kinds of things where you're trying to make up for something, that you think was never there. I don't know enough about this. There are probably people that know a lot more about this than I do, but that's probably one of the hardest things to navigate, especially doing the kind of career that I'm doing as well. I think I'm making some progress.
It's good to hear.
I think so.
It's good to hear.
I think so.
You're smiling, you're happy, you seem fulfilled about what you're doing, so that's a good part in it. I also think that you went down this journey of doing dentistry and then becoming an oral surgeon.
Yeah.
But with that, you don't know that actually you're becoming a teacher as well.
Yeah.
And I think going back to when we were younger, and many people are in this position at the moment, you have your sights set on, I want to do business, or I want to become a teacher or a dentist or whatever it may be.
Yeah.
But I think there's such a variety. I know so many dentists today who are also business owners.
Yeah. Yeah.
But going back to school days or even university days, you don't, they seem, it seems that you can only do one of them. And they're not mutually exclusive.
Yeah.
I think you can do a lot more.
Agreed.
And I see people doing various different roles within their life.
Yeah.
And some people actually take a turn. Some people go through dentistry or medicine or whatever it may be, but come out the other end. And I know someone who's wanted to become a doctor. We both know them quite well.
Yeah.
He wants to become a doctor, wants to become a neurosurgeon.
Yeah.
But now they are doing PR and supporting and raising awareness about certain medical conditions. So still in the medical field, but you're more working on PR because they wanted to balance a better family life.
Yeah. Yeah.
So yeah, I guess there's never a right or wrong.
No, there's no right or wrong. And as you say, you might go in with the idea. I never thought I'd be in the position that I'm in now. I didn't think that I would be in the arena where there'll be so many different people that I meet, or I could wear so many different hats. It's all possible. So that's what I say to, for those who are still unsure of everything, there is an opportunity for you to dabble in everything. I think gone are the days now where you are a one-trick pony. You almost have to be savvy, and you have to take on these different roles. But that's a good thing.
And I just want to wrap up with a final question we'd like to ask guests. If connection is a practice, it's not a trait, it's not something we're born with.
Yeah.
What's still a work in progress for you, in a few words?
So, I said earlier, coming out of my comfort zone. I'm still doing that. I've done it in some ways, and I'm still working on it in other ways as well. But these are kind of more bigger life-related things. So now I don't have any issues with going up to people and speaking to them and asking them stuff. That before, back when I was at uni and things like that, I would just not do it. But now I've got no qualms in going up to someone and asking them what I need, or what I would like to talk to them about. But I think in terms of work in progress, for me is trying to still understand. I'm still understanding who I am, where I fit in. I've spent a lot of time on my career, and I'm trying to now not make it the be all or end all. I think I've realized in the last probably 18 months, there is a lot more to life than just the career. And I'm now trying to take a step back from that, enjoy the career, but also enjoy all of the other bits that come with life. And just maybe trying to learn a bit more about me rather than just being a person who wakes up and goes to work. Because that's all I've known and that's all I've seen. Like, that's all I've learned from is someone who just wakes up and goes to work. I'm trying to not do that. So me trying to learn about myself as an individual is probably what I'm still working on. And then having the courage to tell others about who I am and not be ashamed of who I am, because we are all different. So, and I'm going to say last point is just be compassionate. If you can just be a compassionate individual, I think that is the most important thing. That is what I strive to be, as a compassionate individual, because I think with the current climate of the way the world is, I think we need compassion. And I think that's my driving force behind everything at the moment. So we'll see where that takes me.
Thank you very much, Mohammed.
All right. Thank you. Thanks so much for having me.
No, thank you for your time. And honestly, this conversation has been very inspirational. It's nice to hear your journey, the challenges in your journey, but also the connections and how you've changed as a person to build those relationships, maybe a bit more in your personal life, and with your career. But it's been wonderful to have you today.
Thank you.
And I'm sure we will see your work in progress moving forward, and we'll have an update in many years to come.
Hopefully we can revisit this conversation and see if anything's changed.
That'd be lovely.
All right.
Thank you.
Thank you.